Good afternoon, everyone. My name is Jennifer Bernard. I'm President and CEO of Women's College Hospital Foundation, and it's my pleasure to welcome you to our webinar entitled How COVID is Impacting Women's Mental Health. It's really the global aftershocks of our pandemic. I'm joined today by Dr. Simone Vigod, our Chief of Psychiatry, who will be here with us for this hour where we'll talk about some of the issues that have really been impacting everyone here at home and really around the world. I'm going to start with a bit of gratitude, and I'm going to start with our land acknowledgement. Before we begin, I'd like to take a moment to acknowledge the sacred land upon which we gather here today. I would like to acknowledge Toronto as the sacred gathering place for many Indigenous people of Turtle Island. I want to recognize the long history of First Nations and Métis people in Ontario and show respect particularly to the Mississauga of the New Credit. Today, this land is still home to many Indigenous people of Turtle Island, and we are grateful for the opportunity to live and work in this territory. Thank you. Okay, we're going to get started. We have about an hour together, and it's a jam-packed hour. I'm going to start by setting a bit of context, and then I'm going to turn it over to a bit of a question and answer between myself and Dr. Vigod. And then, of course, you're going to get an opportunity to ask questions of Dr. Vigod. If you want to ask a question, you can just write it in the chat. And as we go along, we'll collect your questions. And at the end of the hour, we'll leave time to answer them. All right, so let's get started. Hi, Simone. I'm going to introduce you properly in a moment, but I'm just going to set some context, as I said. We're going to start with a little bit of more gratitude. Just a few weeks ago, many of you who are probably watching us today took part in the Shoppers Love You Run for Women, which is one of the largest organized events that supports women's mental health nationally. And we've been taking part in this event for many years. And at the beginning of the pandemic, we didn't even know if it would happen. Well, Shoppers was very brave and courageous and went forward with the event in September. And I have to tell you, I could not believe the response that we got from our community here in Toronto, and quite honestly, right across the country. But I want to say a special thank you to our Toronto community who came together in numbers that we had never seen before. Over 1,900 people gathered over 10 days to walk and run with their families and loved ones. And they raised an incredible $338,000 for Women's College Hospital's mental health division. So thank you to Shoppers Drug Mart, thank you to all the associates, and thank you to everyone in the community who participated and came together to support us. So we're going to go right into our program now, and we're going to talk about what's really been torn from the headlines and a burning issue for so many people. And that's why we had to have Dr. Vigod with us today. So I'm going to set it up real quick, give you a little bit of a history lesson, because a lot of people know Women's College well, but they don't know about some of the amazing programs that have evolved here over the last 135 years. And our mental health program is one of our flagships. So many people may not be aware that we have the largest clinical and research program focused on women's health in Canada. And each year we have about 20,000 visits to our program, and we support women at all stages of their life. Today we're going to talk about two special programs that we have here that are truly unique in the landscape, and we play a very special role filling gaps that other institutions don't. And that is our Reproductive Life Stages program, as well as our trauma therapy program. And that's what we're really going to focus on today. You know, philanthropy has made both of these programs possible, and the community has benefited. During the pandemic, I think everybody realized that we started talking about virtual care. And, you know, at Women's College Hospital, this was something we've been talking about for a long time. And we've been immersed in that because we are a completely outpatient hospital, really obsessed with keeping people out of the hospital. So when we had the pandemic, it was the perfect storm to really push ourselves to accelerate our virtual platform. And we did that in mental health. I'm just going to give you a few programs that we worked on and we focused on during the pandemic that really helped us expand our virtual capacity and stay in touch with our patients. So here are a couple of examples. We did virtual counseling sessions for all patients. Thank you, Dr. Vigod. We did virtual family and children's psychiatric services. We also had ongoing Mother Matters visits, which is a revolutionary online platform that connects new mothers with a community of support. And we know how important that is. And we conducted the world's first integrated group therapy session through our patient portal. So all that went on during the pandemic, and we kept our doors open and our services reaching out to the public. All right, enough about background. We're going to get into the meat of the conversation with Dr. Vigod, and I'm going to introduce her fully because I think it's really important that people know the caliber of people working in this space here at Women's College Hospital and the caliber of leadership that we have. So Simone, it's a long list, I'm sure you're aware, but it's well worth sharing with everyone. So Dr. Vigod is a leading expert in women's mental health and has conducted some of the largest studies worldwide on maternal mental illness around the time of pregnancy. She holds the Shirley A. Brown Memorial Chair in Women's Mental Health Research at Women's College Hospital's Research Institute. She is an associate professor in the Department of Psychiatry and Institute for Health Policy Management and Evaluation at the University of Toronto. Her research aims to address disparities in health and healthcare for individuals with psychiatric disorders with a specific focus on women across the lifespan and on equity in access to treatment for diverse populations. Welcome, Dr. Vigod. Thank you for being here.
Jennifer, thank you for having me, and thank you to all of you. I believe close to 150 people signed up for this webinar, and it's really heartwarming for me and for me to be able to be here on behalf of our department. This group who've joined us today, the group who joined us asynchronously for the Shoppers Run, we're going to talk today quite a bit about what the impact of COVID-19 has been on women's mental health. And I think, you know, one of the silver linings has been seeing this community come together to support women and their mental health during this time. So I am so grateful to all of you and grateful to Jennifer for being asked to be here today.
Oh, it's our pleasure. You know, this has been a time, you know, during the pandemic, we're going to, you know, jump right into COVID-19 and what it's done to the world and, you know, how it's impacted everybody so much in the mental health sphere. So, you know, we call this the aftershock of the pandemic, but it's something that's been going on for a long time now. You know, we're well into 6 months into the pandemic, and we keep hearing about how people are feeling this profound malaise, the anxiety, you know, right from children right to older adults, and how it's affected every aspect of our life, from how we socialize, how we communicate, how we work, how we live, how we go to school. And it's no secret, everybody is feeling it. I don't think I have a conversation any day where somebody doesn't, you know, reference their mental health. So we're going to start there, Dr. Vigod. We're going to start with, tell us a bit about how the pandemic has been, you know, had such a profound effect on our mental health, and how it might even be going beyond our mental health and affecting our bodies as well. I'd love to hear your insights on that.
Well, I think, Jennifer, everything that you said already is really true. You know, in March, which is really when I think it became a reality that the pandemic was going to impact us here in Canada. You know, we didn't know a lot about COVID-19, and people were understandably anxious, unsure, uncertain. And so I think some of the impact and the stress was around, you know, Could I be exposed? How sick would I become? You know, I'm always thinking about the lens of women who are caregivers and parents often disproportionately. So people weren't just, especially women, weren't just thinking about themselves, they're thinking about all the other people in their sphere. And then I think, you know, as time progressed, we had the containment efforts that, you know, people are calling the lockdown. But these efforts to contain, a lot of things happened there. So there were financial stressors, job losses, we are social beings, and people were disconnected from their social lives and their social support systems. Children were home from school. So very, very stressful time. And, you know, I think in the beginning, some people were able to take a pause and say, you know, if we do this, and then everything, you know, everything will be okay. It will go back to normal. And then I think part of what's, you know, and sometimes you can get a little bit of adrenaline with that initially, right? But then I think as time has gone on, and it's still not over, I think what you said about the malaise, the fatigue, is true. And I think particularly this fall, you know, we're seeing even more, you know, there's still some containment. It always has to be on everybody's mind. You know, people are tired. And so I think there's, you know, there have been a whole bunch of surveys that have gone out, including in Canada, showing that people are reporting high levels of psychological distress. You know, and there are disproportionate impacts on women. There are disproportionate impacts on people of color. There are disproportionate impacts on healthcare workers, on people of, you know, who have lower paying jobs or sometimes on essential worker jobs, right? So it's not affecting people equally, you know, and, you know, the risk becomes, you know, with psychological distress, that impacts might impact your ability to sleep. You're not eating as well, right? And can get you into a position where your body doesn't feel as good, right? Muscle tension. So I think people are not just having thoughts in their head that are distressing, but I think, you know, what we know about the stress response is that the mind and body are connected. So if you're having you know, if you're psychologically distressed, that can also have impact on how your body feels, you know, chronic illnesses, etc. So I think, you know, whether people developed a mental illness, depression or anxiety or something else, I think that, you know, it's the distress itself can have quite a bit of impact.
Yeah, you know, you've touched on so many things that I think everybody that's watching can relate to. I think I've never sat more than I have sat in the last 6 months. And, you know, people have referred to like sitting being the new smoking. And, you know, we have people who are pretty much trapped inside, whether it's because they're in a small space, or some people are in condos and it's hard to get in and out of, you know, the building quickly, and there's all kinds of restraints. And I think probably the one that you've really touched on, I think a lot of people are struggling with, is sleep. I would say that the anxieties that you feel really make it hard to put your head down at night and turn it off. You know, you feel like yourself, you're on a news cycle. So yeah, all of those things, I can see how they manifest themselves in your body. So now I want to ask the follow-up question to that, because I think because it's so universal right now that everybody is feeling the anxiety, regardless of where you are on the spectrum. When do you know, Dr. Vigod, when it goes from being sort of like I'm anxious and I'm a little scared and I'm a little weary and I'm distracted, to I need help? This is more than a day or two of feeling a bit blue and down. I need more than you know, my friends to give me a pep talk. I need some help, and I need some intervention. So, you know, how do you gauge when you've drifted into that position?
You know, that's such a good question, Jennifer. And clinically, I've worked for many years in one of our programs here where I see a lot of women during pregnancy and postpartum, where I get that question, right? And in a way, there's a parallel to that question, right? Going through a time of transition, a time of stress. How do you know that, this is stress or distress, or actually I should be reaching out or getting my family member or friend to reach out for a treatment like a psychological therapy or even a medication? So I think it's such a good question. And I think what I have said for many years to women and their families around this really applies here. When you are having stress, distress, and you can, you can focus on being kind to yourself, you can get social support, you can talk to peers and family, and, you can be upset for, a few minutes, but then you can bounce back by, let's say, going for a walk or taking a break or taking a hot shower, right? Those are times when I think we would say this is more in the realm of stress and psychological distress. And I talk to people about it being the bounce back. Like, we're all going to get upset. Nobody is going to be zen, and certainly not in a time like this 100% of the time. But it's about how quickly can you bounce back, or do you actually feel like you can't bounce back?
Right.
And then related to that, how sticky, like if you're having these distressing thoughts, how sticky are the thoughts? Because would it be
unpack that a bit?
Yeah, would it be unnatural to, in this context, we have to make decisions about sending children to school, for example.
Right.
Would it be unnatural or abnormal to have some worry about that? And to have the thought come into your head, what if they're exposed to COVID? What if somebody gets sick, right? It wouldn't be unnatural to have that thought, right? But then the question becomes, how sticky is that thought? And are you able to fairly easily weigh the, let's not overestimate the danger something bad's going to happen, or underestimate our ability to cope? Like, how sticky are the thoughts, and do they not go away, right? If the thoughts are...
Oh, we lost you there.
You lost me?
Oh, yeah. You're back. Yeah.
If you're lying awake at night and not able to fall asleep multiple nights in a row, right? That would signify that, this is sticky. This isn't bouncing back. And then, of course, if someone's having really negative thoughts, like, for example, having thoughts that they shouldn't be here anymore, that they don't want to live anymore, like really severe thoughts. So I think it's that. I think it's how quickly do you bounce back? How sticky, how hard are you working to calm yourself down and manage thoughts? And also how severe are the thoughts?
Okay, I'm going to follow that up with, we're going to delve a little bit more into women, because you made a reference to like the unevenness of some of the impacts of COVID on different populations. And we've heard a lot in the news about, the actual disease impacting different populations at different levels, like the Black and Indigenous community and people in different socioeconomic conditions. But I want to really unpack this against that backdrop, but also against women. So here's the setup for the question. So we know that women are on the front line of this pandemic. We know that they make up, between sort of 85 and 90% of the nurses. They are many of the frontline workers you alluded to. They're working in retail and hospitality. They're in many situations, they're the personal support workers, and they are the ones that are also the caregivers. So they're home with the children, home taking care of elderly and sick people. So we know, and we've heard, I think, enough over the last 6 months to realize that even the job losses are predominantly happening in the female part of the economy. They talk about this female recession that's happening. And so I want to talk a little bit more about the unevenness of the impact of COVID. And as a clinician, what are you guys seeing? And how are you helping, perhaps women cope differently than, you would have in the past?
So I think that what we're seeing now in this pandemic, and there are all of the things that you mentioned, it's bearing out in the surveys that are being done in Canada and around the world, that women are reporting higher levels of distress than men, and that also not all women are equal, right? Depending on race, economic status. So you end up with people who have, we call it double jeopardy or triple jeopardy of intersections of issues. And so women already compared to men are more likely to have mood disorders, anxiety disorders, right? Now there are things that men may be more likely to have, for example, substance use disorders. So, so there are, I think one of the things is to take a step back and remember that, we can't consider everybody all the same, and we can't treat people all the same.
Right.
And so, so I think one of the things about our programs is really trying to take that whole view of, of understanding how women's social support systems have been impacted, and understanding this context in order to provide the treatment. And sometimes, I think one of the things that this pandemic has done is people are, sometimes the treatments in psychiatry are about like helping people to see, maybe I'm being more anxious about something than I should be, and learning skills to not be. Whereas I think a lot of what's happening now is we're doing a lot more helping people to problem solve, helping people to be kinder to themselves. I think on balance, women have a tendency to be really, really competent, right? And manage all these sorts of things and juggle. And then suddenly you actually can't because of the containment efforts, and there's only so many hours in a day. And I think if I had to say at the core, what the biggest like therapeutic issue that we're working through with women is helping them to shift their frame around acceptance, reducing self-blame, around shifting the frame about, what can be done and where to set that bar for themselves, because it's stressful enough what everyone's having to manage, without also feeling like you're falling off the mark of an imaginary place where you should be. But it's really complicated because, whereas we would normally, let's say, for example, with a young mother, say, well, yeah, get some help, bring the grandparents in, right?
Right. I wanted to talk a little bit about that because, it's a whole new construct. We have all this social distancing. You have to stay in your bubble. Not everybody has a bubble. I have colleagues and friends who most of their family live out of town. So they're pretty much in their, small space by themselves because they want to keep their bubble as small as possible. So what are some of the, sort of new coping mechanisms that you're suggesting to people? I mean, I think one of the reasons that the Shoppers Love You Run was so successful was because it didn't make everybody come together in one space in one day, and people got an opportunity to choose when they walked, when they run, with who, they were able to social distance. So in a way it worked. But what do you tell people when normally the antidote is community, getting together, being in touch with people, especially women who have almost no time left? Like when you finish all the, the 7 different jobs and the 7 different hats, what's your advice to people on when everything that we normally do has been taken away? What are the things that we're forgetting that we can still do perhaps?
Yeah, I think that's a great question. And we're going to put up some videos that some of our amazing staff here put together. And I think if I had to summarize them, a lot of it would be around what I was saying before, around being kind to ourselves, that not judging, and being compassionate with ourselves about what we can do and how quickly we can do things. you know, and at the same time helping people to think about other and different ways to be able to connect. You know, one thing that was amazing, I think, about the Shoppers Run was it actually allowed some people to participate in a way that they wouldn't have before, because there were people who said, well, you know what, I wouldn't have gone to this big group thing, and I would have been embarrassed to run, and there's so many people. But, you know, I ran with my phone in my pocket and had the voice of the narrator, you know, every kilometer with the GPS saying, you know, good job, Simone.
Right. Some positive reinforcement. Yeah.
You know, and so I think, but I you know, we're so used to our coping mechanisms that we've all had for our whole lives. So this is, that's why I think it's a lot about being kind to ourselves in terms of that we're on a real learning curve about finding other ways to connect with people, and being true to ourselves about what we can and can't do. And then when we do need help, figuring out the safest way to get that help, and that it's okay to do so.
Yeah, I mean, one of the things that a lot of people may not realize is, like, a hospital like Women's College Hospital, we stayed open right through the pandemic, and we did things virtually, and we converted most of our activity to virtual, but we were still seeing people, some people in person. And, you know, what I've realized, you know, we are social animals, you know, and having a sense of community is such a grounding need, I think, for so many people. So I think, to your point, it's in a way we all have had to redefine and find our communities, and in very different ways than we would have before. And I think some of the programs that we have here really help people do that. So I'm going to talk a little bit, we're going to move a little bit into talking about some specifics that we have available to people here at Women's College Hospital that really address some of these issues. So one of the things that I really want to talk about are, you know, the incredible advancements we've had in an area that's probably not very, very well known. You know, there's still a lot of stigma around mental illness, despite probably the most open decade we've had in recent decades, where people are really starting to talk about it. I think the pandemic has made it a conversation, top of conversation. It's in the news. But I think a lot of people still don't want to self-identify as having mental illness. And so we focus here on, you know, what are some of the gaps. And so that's why we focus on women. As you said, they're often, you know, we have different areas of focus that we need. But we know that women suffer different things at different life stages. And we also know they suffer for different reasons. So this is what I want to talk about. Talk about the challenge of, you know, addressing trauma and our trauma program, and why we wanted to have a trauma therapy program, and why trauma has even been introduced to this idea. Because before I worked at Women's, although I'd been around mental health for a long time, I'd never heard of trauma being a driver for mental illness. So I'd like to talk a little bit about the incredible advancements we've made here on women suffering from postpartum depressions and mood disorders, and how your team has launched the other initiative called the Trauma Therapy Program. So let's just talk about that, sort of those two things, like why we do life stages, because I think a lot of people don't even understand that, and then why we decided to do trauma. And then we can get into a little bit more of the detail of each of those.
Sure. I mean, I think just for some background, so our reproductive life stages program, we see women who have really any kind of mental health issue that relates to the reproductive life stages. So that could be around the menstrual cycle, around pregnancy, around postpartum, around the perimenopause. And that program was really developed because those are issues that are quite unique to women. The trauma therapy program was really designed around, instead of not necessarily trauma being unique to women, but trauma being something that disproportionately affects women,
Right.
and may affect women in different ways. And something that people might not realize is that more than half of people who struggle with mental health issues have a history of some kind of early childhood trauma, meaning physical or sexual abuse or assault, emotional abuse or neglect. And one of the things that we've learned from research over the last number of years is that when you have early childhood trauma, it changes the brain. It makes the brain respond differently to stress. It makes it harder for people who've experienced trauma in childhood. Often makes it, they can get really anxious in certain situations, have emotional dysregulation that it's hard to even know where it comes from, and then it can really impact them in their lives. And importantly, sometimes what happens is people who are struggling with mental health issues will get a diagnosis, let's say, of depression or anxiety, but nobody's ever even really asked or understood the whole life history around how trauma might have changed the brain. And maybe the symptoms they're presenting with are sadness or worry, but they might also be nightmares or having certain particular things that set them off that really are distressing. And so that was how the trauma therapy program really came to be, to say, we need to be, and guess what? People who are in that position don't necessarily get better from the traditional mental health treatments, like for example, an 8-week course of cognitive behavior therapy. And so we have to be more, or even from the medications that we give as first medications, right? So we really have to think about integrating a person's whole life history into their treatment. And that's how the trauma therapy program started. And there's a lot of evidence around, trauma therapy coming in stages, and first helping people to connect the mind and body and connect the thoughts and emotions, even before even working through any particular traumas, right? It really starts with working through what are the symptoms and the impact, so that I can get back to my life. And as you might imagine, the pandemic, for someone who has a history of trauma, who maybe is already struggling with depressive, anxiety, post-traumatic stress symptoms, who already is having some difficulty with relationships, with work, etc. I mean, is now more isolated. These are, this is a complex time for people with trauma. But I think, our trauma therapy program is really one of the only programs in the province that offers that comprehensive therapy around trauma in our publicly funded system. And so we've had huge demand. We get over 100 referrals every month. And because we provide treatment, not just a few weeks of treatment, but several months of treatment for people, it fills up pretty quickly. So our projects, especially during COVID, have been around, can we leverage virtual to maybe train therapists in other places, let's say in Ontario at community health centers, to do this kind of therapy? Can we create a group the same way that we did with our Mother Matters for the postpartum patients, where people can learn these skills online, right? And so we've been able to now reinstate our live video groups, as you were mentioning. But I think the biggest thing I would say here is this is a really under-recognized area. And so we're so grateful to our community, to the Shoppers Run, for example, that really helps us to do research and investigation and innovation so that we can address this, because this is, in my mind, this is a real gap. And I think what COVID-19 has done is it has accentuated all of the health equity and access to care, equity and access to care issues that have just made it even more urgent that we are able to get women who have a history of trauma in and to give them treatment. So
You know, I think this has probably been the biggest light bulb moment for me as a person that's worked in healthcare and around, incredible mental health programs. And as I said at the beginning, until I came here, I had never, even myself as an individual, and I think it seems so obvious when you describe it, that having a profound trauma at any point during your life would then shape and inform your mental health. And the fact that most programs don't look for that trauma, and I think the stat you said was 50% of women. So if fully half of the women who have mental illness have an underlying trauma that very few practitioners are looking for, they're probably, I mean, I don't want to put words in your mouth, are they going misdiagnosed? Are they on the right treatments? These are the kinds of questions that come to mind. People want to, live a full life and, get better, so to speak, or be able to cope. And I'm just wondering what happens when you don't address the trauma? Let's play that side out, because I think that really informs when you do address the trauma, what is the difference in the outcome. So what happens typically if a person presents and the trauma is not dealt with?
Well, I mean, I think that I think when we see this is we see people who will come and they'll say, I went through the traditional treatments, I went to CBT, I took an antidepressant, it helped me a bit, but I'm not better.
Right.
Right. And so I think that's the place where we say, actually, maybe you need something a little bit in addition, and a little bit different, because the way that the changes in your brain are actually a little bit different than what might happen, than what might have been for someone with depression or anxiety who didn't have a history of trauma. And I think the thing is, because it's so common, this happens a lot. So, the question becomes, there's a statistic that about 50% of people treated for depression don't get better with their first or their second treatment, right? So the question is, well, why? Is it
right.
just because our treatments aren't good enough, or is actually some part of it because we need to shift and be delivering those sorts of treatments? And I think one of the proofs that was in the pudding was when we designed this online training program for frontline, like community health centers, where they deliver therapy, but maybe don't have just this specific trauma focused shifts that they need to make. Community health agencies jumped on board. They jumped on board to spend their time helping us design the programs even, and giving us feedback. And we're actually about to go live with 6 partners across Ontario who are going to be training with us, and then doing groups with clients there, which is what we need to do. We need to build capacity, right?
Right.
Everyone always says that's women's, right? We punch above our weight because what we try to do is innovate and create and then get it out there. Because we are pretty small, but we want to be able to build that knowledge and share that knowledge, so that, because we won't be able to treat 50% of the women in Ontario.
Right. And this is one of the issues about being the only one, right? So the only one really, focused on this work. And, that's what I love about the empathy of the organization. It really is about scale and spread. We were purpose-built for scale and spread. We're sort of an incubator for, finding the best solutions and then teaching, which I think is, why people, support us and are invested in us, because it's not really about us. It's really about, like, let's get it out there. Let's get women better. Let's make a change. I'm fascinated by this area. I just want to talk about one little bit more about the trauma program. Something that you said it changes people's their brain, like their brain. And can you just talk a little bit about that? Because I was surprised when you said that. I understand when something changes your behavior, but it sounded like you were saying no, you're changed mentally, physically by trauma. Can you talk about that a little bit?
Yeah, I mean, when things happen to us, especially when we're children and our brains are still developing, right? You're making connections in your brain. So if you're a small child and something, really terrible happens repeatedly, your brain kind of adapts to that, right? And so one very stark example might be when the fear gets really bad, you as a child, you dissociate so that you don't have to like be there, you don't have to be part of it, right? You almost shut off to it, right? But then you can imagine as an adult that when there's stress, if your brain is primed to shut off, right, and not be able to cope, then that's going to, right, that's going to mean that you can't do what you need to do as an adult, even though it was really adaptive as a kid because it was what kept you safe.
Right. Wonderful. That's a great example. And I think a lot of people can relate to that because, we are the sexual assault and domestic violence, hub for the province. We are the hub for the addictions program. And we have seen a huge increase in the calls around sexual assault and domestic violence and intimate partner violence. And we know that there's a crisis in terms of, whether it's opioids or other dependency issues. And the pandemic doesn't make those things go away. It's sort of, in a way, it boxes those people in even more. So are you seeing any more people who are sort of asking for help related to those areas in terms of whether it's domestic violence or in addictions? And how do people start conversations about, if they think somebody's in distress like that, like how do they, get them to seek help? Do you have any tips around that, those kinds of traumas?
Yeah, so I think I think there's really clear evidence right now that we are seeing an increase in addiction relapses. We are seeing more overdoses, and there's some very clear data that the pandemic has been associated with an increase in domestic violence.
Yeah.
So that's real. That's not just news media. And so these are very serious, and they have to do. I think a lot of them have to do with the containment efforts, right? So people have lost jobs, people are pinned in at home, and so that makes things very challenging. Especially when our very primary goal with people is safety, right?
Right.
So so in working with people, where we work with people and really try to meet them where they're at to make sure that they and often their children as well, right, are most safe.
Okay, great. All right, we're going to move on to our Life Stages program and talk a little bit about your work there. You're a real expert in this area, and I think that again during the pandemic, women in their reproductive life stages who are having babies, this is a very stressful time. Just this week, I had a friend who had a baby, and it's a really unnerving experience for a new mom. And then to have it during a pandemic, I can only imagine, and I know some of the anxieties that were added on to all the other anxieties. And you shared with me in advance some really worrisome stats around postpartum depression, and I'll just read them out. In some of these stats I couldn't believe them. Psychological distress experienced by postpartum women, 37% of women report that they have psychological distress postpartum, and 57% are suffering from significant anxiety symptoms. So let's talk a little bit about how our program here addresses women who, in what should be, one of the happiest times of their life, are really suffering and really, really having significant problems. Let's talk a little bit about the postpartum depression and the work that we do here.
Sure. And, that was a study that some colleagues out of the University of Calgary had set up early in the pandemic. I think those stats were from maybe April or May. So we don't even, they haven't published on a repeat of that yet, but
Right.
we don't even know where we're at now, and those were pregnant women. I mean, I think what we have been able to do in our programs is you can imagine that, pregnant women, postpartum women, coming down to the hospital for in-person visits is not, is not preferable for them. And so you mentioned this at the beginning, but one of the things that was amazing that we were able to do here at Women's was that the patients can sign up for our portal, MyChart, and we were able to configure our electronic medical record so that they could log into their patient portal and then get into a video visit with their clinician. And also we were able to do our group video visits, which I think, in the pregnant and postpartum population, we do a lot of group work because it's been shown that the shared experience can help people a lot. People don't feel like they're alone, right? And so we've really worked, we have groups for pregnant women on helping them to manage symptoms of anxiety and depression. For postpartum women, helping women with depressive symptoms to manage the transition. And then for women who are actually not able to do live video visits because, it's a little bit easier virtually, but you don't know when your baby's going to nap. You don't know when they're going to cry, right? Like it can be very, and some women are working, even if they're working from home. So we also have this program, Mother Matters, which is our online forum where women can log in 24/7
Wow.
and discuss with each other. And that's facilitated by some of our therapists. And one thing that was really interesting is some of the data coming out of that program is we thought, oh, this will be good, maybe only for women with milder symptoms. What we're actually finding is that women with more severe symptoms have an even greater effect. And some of them were saying that they like that even better than a live forum because they were able to there wasn't the pressure to be in or on at a certain point in time, and they could really sit and think. So what we're really, and the other thing is that ends up being really efficient because you can have, we can have more women participating and more women seen. So we really try to offer a comprehensive service when women come in, and we have a triage telephone call to say, what kind of program, do you need to see the psychiatrist? Do you need, is a therapy group? Sometimes there's something more individual that, that needs some individual therapist work. So we really try to help women to offer something along the whole spectrum. And I think being able we're really doing about 97%, I think, of our visits are virtual and getting really quite nice feedback, I think, from people about their particularly pregnancy, postpartum. Very convenient.
Yeah, that's really good to hear because, we have, as I said at the beginning, a big stake in making sure that we are not just a bricks and mortar hospital, which of course we are, but we also offer things much like in banking where people can do it on their own time, where people can do it at their leisure when it makes sense for them. Everything from, women that are, trapped with their abusers, maybe they do get to go out to work, and that's when it's the best time to have a counseling call and they can get away and do it then. So I think that our push for virtual care really it's shown that it's, we've hit the right time and the right space. But I think that what a lot of people were afraid of is that, people wouldn't want it, people wouldn't be interested, or more severe people wouldn't sign on. So it's really encouraging to hear you say that it's not just the mild symptoms, it's actually people with some severe symptoms that are taking it on. But we do know that there is a bit of a digital divide, and we're testing that ourselves, because we don't want to just do something to say we're the first and the best at it. We actually want it to work for people. As we continue into the pandemic, which we're talking about, we're now in the second wave. And it's going to continue. Do you see, what are you seeing as the, the big learnings that we had from the first wave in terms of how we reach out to people and how we get them into care? And what can we do what would you love to do even more of if you had the opportunity?
Well, I think one of the things that we could do even more of are partnerships, because I think we need to be able to be inclusive as a program, right? And so there are going to be people who aren't going to be able to do digital, and we should bring them in, and our partners in the community who are seeing them are going to, we need to partner with people to be able to bring people in or go out to them, right?
Right.
If needed. We need to really think about how do we make sure that every population who needs access can get access. And I think partnerships are a really big way to do that, because people, are with the healthcare providers who they trust, and then we can build that, because we need to make sure that our services are inclusive. I think that, as we're thinking about apps and, asynchronous groups, and even our live, we need to be thinking even in our hiring about being inclusive and having diversity in our hiring, who we are as therapists and as treaters, right?
Right.
And then also
representation. Yeah.
And then also about whether we need to do different adaptations. One thing that was interesting about some of the data from Mother Matters was women participated from all over Ontario. I think from 10 out of the 12, what used to be called local health integration networks. About 20% of our participants were not born in Canada, which is about the same proportion. So about a 25% of babies born in Ontario every year are to women who weren't born in Canada. So it's actually about right. And a couple of women told us that they preferred the asynchronous forum because English wasn't their first language. And so in a live group, they actually felt a little bit like it was more difficult. But when they were able to post, they could spend some time thinking and composing.
Thinking about it. Yeah, texting, and it helped them not feel so exposed.
Yeah, and so that it was actually more inclusive.
Wow, that's wonderful.
Yeah, and I think the lesson is we need to be asking those questions, and I truly believe we need to be every patient is a partner in evaluating, and we need to be evaluating everything that we do.
I can see that
we won't know where we need to pivot.
Exactly.
And that's when you won't bridge the divide.
Yeah, and one of the questions that have come up, because I'm, thank you for that wonderful sort of grounding. I can see one of the questions in the chat is, it does, in COVID, minority groups are disproportionately affected. And are we seeing that also in mental health? Like, are you seeing more women from diverse communities seeking mental health support? And just wondering if you are actually seeing that reflected also in mental health.
It's such a great question, because COVID has, as I said before, COVID has accentuated barriers that were already there. And there's quite a good bit of evidence that actually some of the way our healthcare systems are structured are not inclusive of women in minority groups, right? And so I'm not sure that access, that access has increased enough yet. And I think we need to do more work to make sure that people want to access services and accessing services.
Yeah, we just did last week a Black Healthcare Summit, and some of the issues that were raised were what you've said: representation, you know, basically seeing themselves reflected in the staff and in the people that are treating them, so they understand their lived experiences. People talked about the trust, you know, the community having very low levels of trust with sort of large institutions because they've been discriminated against or, you know, haven't been treated in a dignified way. So I think all of those things are really important. And that's why maybe more women don't come into programs. So what you're saying is exactly right. We actually do have to go out into the community, build those bridges, build those partnerships, and earn the trust of all the different communities. And you know, I know that that is implicit in what we do, but one of our real strengths is teaching other organizations to do that as well, just like we have with sex and gender, where you look at everything through a sex and gender lens. And then now we're layering on other lenses, which are so important for equity. One of the questions that have come up is like, why is there only one trauma program? Like, what's the resistance if there's so much evidence that it works and so much evidence that 50% of women have had some sort of trauma? Why isn't everybody, you know, offering this kind of care? Like, why isn't it adopted and accepted? You know, do you have any insights on that?
I think that the concept of something called trauma-informed care has come up over the last number of years. It across all disciplines, to say like we need to be conscious of people's trauma and how that might be affecting them in other, you know, in other areas. An example would be if we're giving pap smears to women, for example, or mammograms to women who have a history of trauma, like let's think about how we can make that experience better for them and more comfortable for them so that they don't not go, right? And then get under-screened, right? And then have worse health outcomes, right? I think what has been a bit slower to come through is that if you think about the number of years of training that it takes to train a mental health therapist, a psychologist, a psychiatrist, we're in the midst of changing the pipeline of programs to get people to do not just trauma-informed care, but trauma-focused therapies, right? And so I think part of it is about making sure that is actually going down, and that's something else we can do at Women's, right, is educating.
Right. And I think, you know, like, I think you've made a great point. It's not just at the level of the institution. You actually have to take a step back in how people have been trained. And it's the same when we were talking about bias training, you know, systemic racism. A lot of it starts with the training, and that's where it has to begin. So I want to answer a few more of the questions that have come up. They're coming up fast and furious now, so I'm just going to look at another one. Here's one. Would you be able to tell us your top 3 tips to help us manage our mental health as we go into the winter months of the pandemic? So, you know, something each of us can do to make sure that we're taking care of ourselves. And I know you've sort of framed them at the beginning, but I think it's a perfect way to sort of frame them at the end. So what would you say are your top 3 tips for how people can manage, you know, through the pandemic, which unfortunately is continuing?
Yeah. I mean, I think I almost want to say that my top 3 tips are all the same, which are be kind to yourself, be kind to yourself, be kind to yourself, because it all flows from there. Because judgment and self-judgment leaves no room for empathy.
Right.
And leaves no room for acceptance. And when we cannot change, you know, there's like a fork in the road, right? There's a point at which you can problem solve, right? But there's a point at which there are things you can't problem solve, and then it becomes unproductive, like spinning your wheels if you keep on going towards problem solving. If we can force ourselves to be kind to ourselves, judge ourselves less, that should lead us to be able to be more compassionate with ourselves, should help us slow ourselves down so that we can then you know, then because I could tell you things like find joy, you know, in something you can do, and you know, right? But I really do think it's that by being kind to ourselves, if we're not judging ourselves, then we can slow ourselves down enough to try and find some of those joys, to problem solve the things we can problem solve, right?
The things you can control, because I think that, yeah, I mean, there's a lot of anxiety with people who have children going back to school. I have 2 boys in school, and that has created a whole, I think when all the kids were sort of at home, that was one layer of anxiety. Anybody who had their children with them 24/7, and not everybody's home is set up for that. But now that the kids are back in school, that's a whole other layer. And one of the things I told a friend of mine, which my coping mechanism is, I speak to myself as I would speak to a friend. And you know, for me, I say a lot meaner things to myself than I would ever say to anyone else. And so for me, my being kind to myself, if I took your advice, would be like, every time I have a negative thought, I think, you know, if somebody said to me, I'm feeling really bad, I've been sitting on the couch for 3 days, I'm really unproductive, what would I say to them? I would probably say, well, you've probably been working 12 hours a day on Zoom calls, and you just need some time to regroup, as opposed to you're just not getting it done. You gotta find a new level, which is what I think we do. We sort of beat ourselves up. So I would say, for me, how I interpreted that was, you know, speak to yourself in a voice that you would speak to a very good friend that you were trying to console, as opposed to the mean inner voice many of us have that just says you need to do more, you're not doing enough, you're not solving every problem. So I do think that that's good advice, and it's a lot harder than it sounds, because I think we are, as you said, programmed to critique ourselves, programmed to say we're not doing enough, programmed to feel like we're failing. And when there's so many things that are out of our control, I think that really leads you down to a dark place. So, so going back to the beginning, I think what I heard from you is, when you can't bounce back, when you're not bouncing back the way you did, and it's taking much longer, when you can't turn it off, when that's all you're thinking about, when you cannot sleep, when it's interrupting your activity, that's when you know it's beyond, you know, a momentary or a natural kind of anxiety or issue, and that's when you should reach out. Have I sort of framed that properly?
Absolutely. Absolutely.
Okay. All right. Well, that's good. And that brings us right to 1:29. We're right within our hour. We are going to make some resources, some videos available online, so that people at their own leisure and at your own time frame, when you're being kind to yourself, can watch them. There's only so much you can do in an hour. And what we wanted to do was, I think, give people permission to ask these questions, and know that many of us are having, you know, regardless of what we're doing, feeling the same way, and know that, honestly, that there is help. So thank you so much, Dr. Vigod, for sharing what we're doing here at Women's College Hospital, and what our mental health program is doing to support women. And again, thank you to all of those who tuned in and joined us, and also came out to our Shoppers event and are helping to support our mental health program. We truly are doing things that no one else is doing, and you're helping to make that possible. Have a good day, and we look forward to speaking to you again soon. Thanks again.
Thank you, everyone.